Hi, everybody. Welcome to our Globe Events panel about venturing out safely and socializing this fall. I am joined by an amazing group of physicians from the region and researchers. This is an all-star COVID lineup, if there is such a thing. We are so fortunate to have this group with us. In addition to being amazingly professionally accomplished, they're also parents themselves who are coping with all of the things that we're dealing with, whether it's deciding between remote versus hybrid school, whether or not to do sports, whether or not to see your friends, how to actually maybe, hopefully, retain some semblance of normalcy in the absolute most abnormal scenario possible. So they're going to be sharing their experiences both as professionals in the field who are really at the cutting edge of COVID, but also as human beings who are parents who can talk to us as real people and offer hopefully some real advice. So I'd like to introduce them now, one by one, if they would like to chime in. And thank you so much, everybody, for being here. We have a huge group today. So hopefully this will provide some information for all of you who are so curious. Welcome.
Am I starting?
You can start. We are also joined and presenting with some help from Boston Children's Hospital. Hello.
Hi. Hi, everybody. I'm Roddy Young.
That's your cue.
Yes. Hi, everybody. I'm Roddy Young, Chief Marketing Officer at Boston Children's Hospital. Thank you so much for gathering us today in this esteemed panel. And thank you all the families who are tuning in. This is a great opportunity to get questions answered to the things that are going on. We believe at Boston Children's giving family the resources and answers that you need to make the decisions to help guide your children's health, especially in these times. So take a moment, if you have a chance after the panel's over, to go to our COVID-19 resources. We've gathered stuff about returning to school, socializing safely, getting vaccinated. Other topics that you may have are answered on our website at bostonchildrens.org/COVID-19. And I look forward to hearing from our experts today. And thank you all from all of us at Boston Children's for participating in this important discussion. Back to you, Kara.
Thank you to Boston Children's for helping to pull off this absolutely, hopefully, what will be a really informative and amazing event. So I'd like to introduce my panelists now. Alyssa, would you like to start?
Sure. Good morning. I'm Alyssa Perkins. I'm an associate professor of emergency medicine at Boston Medical Center and Boston University School of Medicine. I have a research background in studying infectious diseases of public health significance, and I have a third grader and a fifth grader. We elected to send them back to school in the hybrid model this year. We actually would have gone full in person had that option been available. We made the decision that given the low prevalence of disease in Massachusetts at this time, as well as the strong infection control plan and disease mitigation measures in place in our district, we felt that it was safe for our children to be in school, and any risk of disease was strongly outweighed by the benefits to my children's education and mental health, so that was the right choice for my family.
Yes, I'm going to preface this. Sorry, I should have said everybody's going to talk a little bit about the school decision that they made for their child too, just to sort of situate us and ground us in risk tolerance. So Lakshman, do you want to go next, please?
Sure, I'm Lushone Swami. I'm an ICU doctor in Boston. I'm also a medical director at Mass Health. And I am, more importantly, a husband and father to 3 children. One is entering first grade, one is entering kindergarten, and one is hopefully exiting diapers soon. He's 19 months old. And we, yeah, exactly. We'll see. He's getting out of diapers before he's found a suitable replacement, let's say. For us, we decided to try to send our kids to in-person school. And what that means is that our kindergartner will be attending school in person full on. Our first grader will be full virtual. And we're going to see how things play out and how that changes in my town in Brookline. That's the way that it's sort of rolling out. I think from our perspective, it's really, first of all, an individual decision, but it's also, most importantly, like Alyssa mentioned, it's really based on the prevalence of disease in the community. That's the #1 factor. And whatever the schools are doing, if the school said, everyone come on in, and that prevalence spiked, I would be pulling the kids out. But right now, I think we have an opportunity. I think the rates are low, and we want to take advantage of that to get what education we can in while we can. Thanks.
But important to be flexible and pull out if you feel like you need to. Lindsay.
Hi, thanks for having me. I'm Lindsay Leininger. I'm a public health scientist here at the Tuck School of Business, Dartmouth College, lovely Hanover, New Hampshire. Northern New England represent, right?
Thanks for making the virtual trek.
That's right, that's right. You have a lot of readership up in my neck of the woods, so I'm delighted to represent Northern New England. I am part of an all-female team of scientists, the Nerdy Girls, running Dear Pandemic, which is an educational campaign about the pandemic on social media. I have 2 kids, one in kindergarten, one in 3rd grade. They are both in person. We also have very low counts of circulating disease in our community, and my kids go to a school that's on 140 acres, so we are able
they can spread out.
We're able to make it work.
And last but certainly not least, Weston.
Hi, my name is Weston Branch-Elliman, and I'm an assistant professor of medicine and infectious diseases at Harvard Medical School. I also have training in epidemiology, and I actually did an infection control fellowship many years ago. And before I transitioned to my current role, which is as both an infectious diseases specialist and an investigator at the VA Center for Healthcare Organization and Implementation Research, I was actually the hospital epidemiologist out for the Eastern Colorado VA healthcare system, and I worked in designing a pandemic response for Ebola. So I have some experiences not only developing, but also implementing infection control interventions in the hospital. And more recently, since I've transitioned to more of an implementation and research role, I work on taking infection control and antimicrobial stewardship, which is one of my other passions, into non-traditional settings. So we've been working on moving things from inpatient to outpatient and hopefully ultimately to the community. And so I sort of had a natural transition to taking some of my research interests and then applying them to COVID for community and school settings.
So clearly our panel, oh, sorry, go ahead. I don't want to cut you off.
So similar to the other panelists, one of the major drivers in my decision about what to do with my kids involved the community prevalence levels. But we're really fortunate to live in a community where there's almost no COVID at all. So given the low prevalence and honestly the harms and difficulties with remote learning, we did opt for hybrid. But honestly, our levels are low enough, less than 1%, that I would have been happy to send them for full day if that was an option, but unfortunately it wasn't. Remote learning was really, really tough on my kids who are going into 3rd and 5th grade last year. And so I think it's really important to get them into an environment if we can, and if we can make it safe for both students and for staff. I think it's important that we think about everybody's safety and not just think about the safety of our kids, but also the safety of the teachers and the staff.
So clearly we have a very well-informed, excellent panel, and I am qualified in absolutely no way except to ask questions, but I will say from my perspective, my children are remote this fall. I have a rising 4th grader and I have a preschooler, and they're both going to be home this fall. And I made this decision clearly not, as somebody with a medical background, but because I have a high-risk family member who helps with childcare, and also just personally, and I think that this is true for a lot of parents, my own level of risk tolerance and what I, as a layperson, am reading in the media, COVID sounds so scary that even the tiniest speck of risk to me was not worth it. I was thinking, what if my 3-year-old walks in the door with a runny nose? I'm going to be panicking that he got COVID. What if my 4th grader, spikes a fever? Is that worth it for my own mental health? I didn't think it was, but it was certainly a very hard decision. And it's something that I think a lot of parents are grappling with. So on that note, I think that this is something that is on a lot of people's minds. And I keep getting this question. It is broad, but hopefully it is answerable, perhaps. How soon are kids' lives going to get back to normal? When is this actually going to possibly end? Is there a light at the end of the tunnel here? I know that Pfizer, I think it was, came out with news that they'd know if they had a vaccine that was effective by the end of October. That sounds really optimistic. What are your thoughts about the possibility of having something, helping us sooner rather than later? And I throw that out to any of you who feels qualified to prognosticate a little bit.
So, I think when we talk about vaccines and, whether or not there's going to be a vaccine, I think there are lots of things to think about. And efficacy is one of them, but safety is another. And I'm sure everybody saw in the news that one of the vaccine trials was actually paused due to a safety problem. And so it's really important from a public health standpoint that we think about both. And this is not something that we want to speed up too quickly. We want to make sure we have evidence of both safety and efficacy. And even if we can establish both of those things, questions will remain. You know, not every vaccine lasts every year. There can be shifts in the virus, so a vaccine that works now may not work in the future. So I have been relatively less optimistic, I would say, than many of the reports in the press about the probability of a vaccine coming. You know, the history of vaccinations is littered with not only successes, but also failures. And so we have to recognize that a vaccine may take a while, if it ever comes at all, and make our plans accordingly. It's also possible that we do get a vaccine, but it's only 40% effective. That's not terribly uncommon to see vaccines that are between 40 and 60% effective. So we may be looking at the same rates of community COVID, even with a vaccine. And so some of these things, a vaccine is an additional strategy on top of what we already have, but it's not the only strategy, and it's not the only strategy we're going to be able to rely on.
And I guess just to add a little bit of optimism to that somewhat
Could you
pessimistic
please?
view, it doesn't mean that life is going to continue the way it was last spring. I think over the last 8 months, we've really learned a lot about what mitigation measures we can successfully use to try to get lives a little bit more back to normal. And so I think we can employ some of those mitigation measures and have lives that are much more enriched than they were last spring. I think what we need as a society to do is to learn to live with some level of disease around us. We need to make choices that will keep that disease burden as low as possible, and then figure out, you know, what our risk tolerance is, as you talked about, Kara, to figure out how we can move forward with this vector of disease, but still not totally secluding ourselves.
Well, let's talk about that. I want to actually, that leads into the next question that a lot of people have, and that's about socializing when they have made different choices in terms of schooling. So just to use myself as an example, I'm remote. My child's two best friends are remote, but they have other friends who are hybrid. They're going to school. They're doing other things. What are sort of the parameters that you think are safe in terms of socializing with kids? Should they have little pods of people who are doing the same type of schooling? Can they go back to socializing as normal if only they're outside? What are sort of the broad regulations that you think might work to try to get back to a little bit of normalcy, unlike what we saw in the spring? How would you advise parents?
I can take that, Kara, if that might be
Please.
helpful. So
Yes.
we do a lot of writing about children and families on our platform. And this is obviously a hot question for our community, but also for me as a parent. And I think the best way to situate ourselves is if you think of your household risk exposure like a budget, and you can only spend so much of that budget in terms of risk. And just like it's inappropriate for me to opine on your personal finances, it's kind of inappropriate for me to opine on somebody else's risk. You can only protect your own family. So when I think about, protecting my own family, first, amount of circulating disease in the community, right? That's really got to stay. You've heard all of us unanimously say how important that is. And then you have to think of safety protocols like a Jenga game, okay? So you build up a little safety piece, you build up another safety piece, you build up another safety piece, you build up another safety piece, but there are a few Jenga pieces, if you pull them out, the whole thing can fall down. And those pieces that you pull out are going indoors. They're going in poorly ventilated spaces. You have to think of all of these protective measures as additive, but there are a few linchpins that if you pull that sucker out, all of your protected measures are going to come down. And one is community prevalence. Two is going indoors. Space is a big one. We really advocate for the stay smart principles. Keep your space, mask up, air matters, right? So outdoors is best, or make the indoors like the outdoors. Restrict your time and your bubble. That's smart. So
I want to follow on to that. I want to do a follow-up then. So if we're hearing that outdoors is best, keep to your bubble when possible, airflow and so forth, how safe then is it in a classroom that is indoors with people who, you're thrown in with a variety of students whose families might be observing very different levels of risk than your own? Why is that okay right now?
Well, it depends on two things. It depends both on the level of circulating disease in your community as well as the infection control protocols that have been in place. And I think what's reassuring to me, I can only speak from my own context, is that all the educational institutions that I've had the pleasure of advising over these past few months have done really well on the protocol front. Now, I know that conditions don't allow that in some resource constrained settings, but they have been very conscientious. So I think we can't be like classrooms are okay or they're not okay, because my children's classroom on 140 acres that's outdoor is very different than a crowded inner Boston classroom that's poorly ventilated and you can't space people out.
Right. And that's so important to point out, not everybody has access to the same resources or to the same, types of classrooms. This is a little bit different in the sense that, in March, I think that there was a baseline where we were all just told to stay home whenever possible. And now all of these questions are being raised because the restrictions are being left, we're being left to our own devices a little bit as restrictions ease, which
and
is.
Kara, I want to hear from my other panels, obviously, but I just want to close the loop. When the collective of the group on this panel were speaking yesterday, we all talked about you can't just think about the risk in the classroom. You have to think about the risk of what kids are doing outside of that. And all of us on this phone call were like, yes, preach, right? So you can't just think about what the classroom looks like. You have to think about what the alternative daycare looks like and social structures when you're making this balance.
Absolutely.
And if I can just jump in, I think adding to that, it's also about what all the adults are doing, right? So what are we doing as adults? It may have way more impact than what kids are doing in school. I think school is potentially, it's all individual, and it's potentially a very low risk environment. If you have good mask adherence, if you have good ventilation, if you have distancing, if you have a good combination of those things, that's potentially one of the lowest risk activities your family is exposed to. And the problem is that risk is invisible, and risk happens to you without you knowing it sometimes when you're suddenly in a social circumstance where people are suddenly a lot closer, people are taking their masks off, and it's hard to recognize those things as, oh, this is like, there's a red flag going off here, because you have to, it's not intuitive, right? So I think that an important thing to consider is that the starting point, like you mentioned, in the spring, we're all kind of like on this really intense lockdown state, right?
Yes.
It's very different now, right? It's very different, but some people might still be, and I've heard this from teachers, I've heard this from a lot of people, that some people are still in that lockdown state, right? They're still saying, I'm not going to grocery stores, I'm not leaving my apartment, I'm not leaving my house at all. Well, in that case, any amount of risk is going to be significant, but there's costs to that too.
Let's talk a little bit about that, especially in terms of costs of keeping children inside and being afraid to go out and do anything. And I know some people are, they're afraid to have their children play sports or to do extracurriculars. Can we weigh in a little bit on that? So how safe are common fall things like sports, soccer, baseball? What about indoor things like hockey or dance? Where do you draw the line, and how do parents draw the line?
So can I start with maybe a little bit broader framing even before we get into the specifics of that question? I think that what's important is for every activity that we undertake, we have to measure the risk of undertaking that activity with the potential benefit that we get from that activity and the risks of not engaging in that activity. So we know how to mitigate COVID risk to some extent. It is much more challenging to think about how we mitigate the risk to the mental health of our children and how we mitigate their social development if we don't allow them to engage in any activities. So, I think any activity that we're considering, we really need to look at sort of both sides. And I think that especially falls for school, but it also applies to any sort of social activity that we want our children to engage in as well. We really need to look at both sides of it.
So can we weigh in a little bit then on what, go ahead.
I was going to say, I also think it's really important to look at risk as summative. So, it's not, one thing I've seen is that there seems to be kind of an all or nothing approach. People stay at home, they don't want to see anybody, they're not going out. And it's important that as we do begin to open up and engage in additional activities, that we make choices about where we're going to take risks and where things are important to us and where we're going to potentially not take risks or even dial back risk and be a little bit safer. So infectious diseases, unlike many of the other medical conditions, in order to get COVID, you have to do something to get exposed to COVID. It's not like cancer where, you know, smoking increases your risk of getting cancer, but if you don't smoke, you can still get cancer. If you're never exposed to COVID, you can't get COVID. And so what you want to do is make sure you have multiple safety interventions in place. So I recommend always having at least 2 infection control strategies on board at any time. And then make sure you don't do too many things to increase your risk of bumping into COVID and then getting COVID. So it's kind of an interaction of making sure you have risk mitigation strategies and also thinking about being safe in multiple contexts. And if I want to send my kids to school, that means I'm not going to do other things so that they can go to school for 2 reasons. 1, I think school is really important. And 2, I need to do what I can to keep my kids and also the teachers safe. Because if we engage in unsafe activities outside of school, that's not fair to the teachers and the staff who we have asked to return to the building. So we need to keep in mind our overall risk and everything we're doing, not just look at one activity at a time. You need to kind of look at it more globally.
So to put a finer point on that for
helps, if an example helps, my son is playing outdoor soccer. My daughter is not going back to the gym. She's doing Zoom gymnastics.
So I was going to say, so that's a good point. So to put a finer point on it for parents then, so I can hear, you know, the wheels turning for people. Does that mean, okay, if I'm sending my child to school, does that mean I automatically eliminate something else? And if so, what do I eliminate? Does that mean if you send your child to school, they shouldn't do sports? Or if your child is remote, they can do sports? Is it an either or? What is the mental calculus there?
Can I just say, well, you know, I think it's like in the 50s today. This is my favorite weather, actually.
I know.
Cool.
Me too.
But, you know,
it's
we live in New England, and
yes.
We have coats. And I think that we should be doing as much outside for as long outside as we can. And that can be pushed pretty far. I mean, come on, we've all seen people. I might be one of those people who's like out there running in the middle of January, right? So it doesn't have to be that, you know, obviously people have other health issues and all of that, but as much as possible, if you're gonna say my kids are in school, I have to not do something else, it's the indoor thing that you don't do. And it's the outdoor thing that you feel very comfortable doing. You know, the contact stuff is much less. The spread by contact is way less than by droplet or aerosol or anything like that. So I think being outside gives you so much protection that as long as you're still able to largely distance and wear some kind of face covering, I think you're in pretty good shape.
So let's talk about that.
Perhaps it's a good winter to come ski in northern New England, everyone.
We might, is that an invite to our 800 listeners right now?
That would not be infection control proof by my medical colleagues here on the panel.
So, right. So that was going to be my next question. What happens when winter comes? It is inevitable. Winter is coming. What happens next? So right now in fall, we can sort of be in this safe limbo a little bit where the kids can do outdoor soccer and play dates. What happens in the winter? Are we, you know, is indoors off limits at all costs? Are we going back into our bubble that we were in March? What's going to happen for families then? And how can they protect themselves? Anybody?
Well, I think one thing to mention, adding onto that, is that we haven't really talked about this, but privilege plays a huge role in all of the risk decision making, right? If you have the privilege of having a large backyard, if you have the privilege of having a school system that's able to really invest in these things, if you know, it's all privilege overlays all of these decisions, and COVID really widens disparities in every sense. So I think we have to be really conscious of that, because it's easy to think about what decision am I going to make, but I think we need to really be thinking, what decisions are we making as a community for everyone's children, for everyone's, you know, for working parents, for everyone kind of together. We know that there's huge racial and ethnic disparities. We have to be addressing those things head on and thinking about them as a group rather than everyone for themselves.
Right. So with the advent of cooler temperatures, how do we keep everybody safe, as people might be tempted to move social gatherings indoors, or to move play dates indoors, or to, enroll their kids in indoor activities? How do we responsibly do that? What would your recommendation be, keeping the broader good in mind?
So I'll take it first. I'm sure everyone wants to say something about this, but I think briefly, the first thing is that you want to delay that and minimize it as much as you can. We've said that, fine. So now we're in a circumstance where we're saying, look, it's really, we can't just be totally cooped up and and locked away from each other, right? And in fact, I think more importantly, practically speaking, it won't happen. Right? People are going to be mingling a lot more. So how can we do it intentionally and safely? Well, I would say it's the same way that we consider it for our school systems, where if a room doesn't have great ventilation, there's things you can do to improve that ventilation. You can put a portable air filter in there. You can increase how much the air cycles in the room. So if we build safe spaces intentionally, and put kind of restrictions on like how many people and all of that, then we'll be able to use indoor spaces as well. It sounds like a terrifying thing to me to say that out loud almost, but
that sounds like
we have to do that. I know, but we have to do that. We have to do it consciously, and we have to have those safe spaces, and we have to know when to really start using them, and to make sure that it's not too early, because we want to use outside. Outside is a great privilege.
Yeah, I'm going to completely agree with that. I think it's really important for us to acknowledge how much we all, but especially the children, suffered last spring. And I don't think many of us are willing to go back to that same state. So we need to be very intentional about how we socialize. The opposite of being in school, for example, is not a perfect quarantine. It's people doing what they're actually going to do, which is going to daycare, hanging out with their friends. So we need to make allowances for socialization to happen safely. We need to provide spaces. We need to provide opportunities to make it safe for people to socialize. And I agree, there's no such thing as awful weather. There's just inadequate gear, right? So invest in a heavy winter coat, invest in a hat, plan on having short gatherings outside, even when it's cold, and then make safe indoor spaces for, maybe briefer interactions. And you can even have the windows open, right? There are ways to do it even in winter, such that we create an environment where people can still interact safely.
And Kara, can I add something just a little more down home, if you will?
Yes, please.
Yeah, so I'm just going to give some examples of what some of the people in my circle are doing. So my nerdy girl colleague at Dear Pandemic, Malia Jones, she's an epidemiologist in Wisconsin, not a warm place, right?
No.
For Thanksgiving, she's dressing up as a pageant queen and is getting on a float and throwing candy to kids. I mean, that's fierce, right? And the students here at Tuck, I mean, they are so social. Business school students are social. And so they're working with our administration to come up with some fun, creative ways to socialize, like cider chats outdoors. And I mean, this is all about being creative. And if anybody is creative, it is parents, right?
Yes.
Like, y'all got this.
Can we talk, though, about those I
was just going to say, the other thing is, I've heard a lot about, like, it's cold. Back during the last pandemic, they had school out on ships in basically sleeping bags. And my daughter did horseback riding all last winter outside, and that's one of the safer things to do, because it's really hard with a big animal to get within 6 feet of someone, and it's outside, and you can wear a mask.
Mm-hmm.
So, there are kind of multiple levels of protection, and, her hands were a little bit cold. So we got her some warmer gloves, and so it's important to remember kids are pretty tough and pretty adaptable. And, if you explain to them, they can usually comply. And, with more gear, you can make a lot of improvements. And there are things that you can even do outside. And so I think that we have sort of been looking at, like, oh, we're going to have to move inside, but we may have to kind of shift that paradigm to thinking that we're not going to move inside.
So it seems like the fresh air is really the big factor here, like outdoors at all costs.
It's the foundation of Jenga piece.
Yeah,
right. It's one of the two, community prevalence and outdoors. You pull those pieces out of the Jenga puzzle, and
Well, can we talk about, Lindsay, can we talk about community prevalence a little bit? Because I think that this is a source of doom scroll for parents. Every day there's like a new headline about, oh, there's 239 new cases in Massachusetts, and where are they coming from? And, you know, what rate are we? And people don't understand the numbers. I don't understand. I'm just a journalist. I'm not a numbers person. I don't know. And people see those and get scared. At what point do we know, okay, we're actually at a tipping point here, and maybe school's a little iffy, or maybe, you know, we need to scale back a little bit? Can you translate this for a lay audience? At what point do we know that things are veering into bad territory again? And I think a lot of people are scared that, you know, with flu coming in the winter, it's going to be just all bets are off. So tell us, when should we get scared again?
So Kara, okay, so I'm here to reduce people's fear, not amplify it. So
Please.
We'll come from a place of hope, not of fear. But the metrics are confusing, and every context needs a slightly different set of metrics. Here in Grafton County, where I live, we can literally count all the people with COVID. New infections and existing infections. Other places can't do that. So you need to look to your decision makers for the metrics they're using. Now I can tell you a little, and you can demand that they transparently tell you what they're using and explain it to you in an English language sentence, or a different language if that's where your setting is. But I will tell you ones that we look at the national number, and that's about, okay. I think national experts start paying more attention when they see 10 new cases a day per 100,000 population. And that's just to give a standardized metric across places. They also get nervous here at Dartmouth. They get nervous if more than 1% of all of the tests that they're doing come back positive. That's when they're going to reassess what's going on. That's their pulse check. So we're both looking at the number of new cases per day on average per 100,000 people. If that's too confusing, that's a lot of denominator stuff. It's okay.
That's what I was thinking.
Wonderful visualizations on NPR where you can literally go and see this. And a 1% positivity rate on campuses. I think 5% positivity rate. So 5 out of every 100 people being tested is the World Health Organization standard.
Where the other thing to keep in mind is trends are really important depending on it's not just the number, but what's happening in your community. Are things getting better or are things getting worse? Because some of these tests stay positive for a long time. Sometimes it's hard. There's delays at all aspects of the testing system. So it's really hard to know if when we're detecting a case today, if that is somebody who's actually infected, a week ago. So being able to understand whether things are getting better or getting worse it has to play into this as well.
And you can go on the New York Times, to Alyssa's amazing point. I probably shouldn't be saying this on a Boston Globe panel, so Kara, cover your ears. But the New York Times dashboard is really clever because it talks about the measures that I just talked about, but it provides some context, and it does what Alyssa says, where it shows what we in the data business called spark lines. So it's little trend lines. So you can literally, in one eyeball, you can get all of that information visually.
Okay, but here in New England, it seems like we're on fairly solid footing right now.
That's right.
Okay, could we talk then about, and I wanted to direct this to Weston especially, because we're talking about outdoors, right? But masks are the other big factor for parents where we feel like this is huge. Can we talk a little bit about masks and how to wear them and how helpful they are?
Absolutely. So the first thing I would say is to think broadly. You said masks, but I think choice is important. And so we often, a lot of the press that I've seen across the board has really focused on one aspect of mask wearing, and that is filtration capacity. We need to think about the effectiveness of face coverings as a function of not only filtration capacity, which is what everybody reads about in the news, but also of fit and of fidelity or adherence to the intervention. So all three of them are important. And we've seen a lot about filtration, but much less about fit and fidelity to the intervention. So it should seem obvious, but a mask only works if it's kept on your face. So if you have a mask that is uncomfortable or hanging off, it's not going to be effective. So you need something that's covering both your nose and your mouth. And I'm also a big proponent of also potentially covering the eyes. There's a lot of emerging data about the importance of eye protection. So I have been a big proponent of face shields, for example, for community use to add eye protection to the protection that you get from wearing a mask on your nose and your mouth.
Is that something that's available for kids?
Yes, so there's this blog called HAI Controversies. You can Google it. And Mike Edmond, who is the chief of quality at the University of Iowa, he has a running list of all of the face shields available on the market. You can email him if you find another vendor. And he has a full section on face shields for kids. And some of them have animals, some of them have rainbows, some of them have monsters, dinosaurs, whatever kind of your kid can decide who they want to be with their face shield. So that's a really good resource for finding them. They're also available on Amazon and Etsy and other places. I happen to like the Duo shields, which I've gotten from my kids off Amazon, to provide eye protection. So, and that sort of takes care of the fit. So you want to make sure that the nose and mouth and potentially the eyes are all covered. And you want to make sure that the mask is sufficiently comfortable, or the face covering is sufficiently comfortable that the kid can keep it on for long periods of time. What you really don't want is something that is uncomfortable or is going to kind of stretch out and then fall out over the course of the day and then not work. So a lot of the questions I get, like, you keep talking about comfort. Why are you talking about comfort? Who cares about comfort? You care about comfort because ultimately that translates into adherence. And adherence is really, really important because otherwise the intervention doesn't work at all.
Do you think that it's dangerous or not a great idea then for kids to be going to school or playing sports if they don't have those eye shields? How dangerous or risky is that?
So the answer to that is we don't know. We're getting emerging data about the effectiveness of eye protection from both healthcare settings and even some community settings. So in healthcare settings, I can tell you anecdotally, we sort of shifted from universal masking of providers to universal masking of providers and patients, but we didn't actually control spread within the hospital until we added on eye protection to that. And in community settings, there was some recent data from India that showed ongoing transmission in communities with community healthcare workers seeing COVID patients were only wearing masks that did appear to improve considerably once they transitioned to the addition of eye protection with either a face shield or with safety goggles. And then a meta-analysis demonstrated an 80% risk reduction with the association of eye protection. So I'm a huge proponent of eye protection. And I will tell you that when my daughter does horseback ride, I make her wear jockey goggles. Apparently she's the only child who has to wear them. She complained about it bitterly, but I have just told her that if she wants to keep on going to horseback riding, she will be wearing those jockey goggles, and she accepted that.
What about, that actually brings up something that a lot of parents have been asking about, and something that's very much on my mind, having pulled my 3-year-old from daycare for the fall, and adherence, right? I mean, my toddler is ripping off his mask. He doesn't keep it on. I don't know many kids who, little kids who do. How safe is daycare right now? What is your recommendation for parents who are worried that, their child won't stay masked or won't be able to properly social distance?
So as I said before, kids are adaptable and they're pretty tough. There are also things that we can do to make it a little bit easier for them. So for example, they make these headbands with buttons on them that can actually keep the face mask kind of up and off your ears. I also find that when you talk, it keeps it in place. So getting back to that kind of fit and adherence piece. So there are some kind of additional PPE strategies from the hospital that I have applied to my kids. So my daughter always wears a button headband with her mask. And she actually just did drama camp outside for 2 weeks, and she wore the mask from 9 till 3 o'clock every day. She only took it off for lunch, and the headband kind of kept it in place and kept her appropriately covered. So I like the Scrunch City makes them. I highly recommend the ones with kind of 2 buttons. I'll also say my sister is a pediatric dentist, and she uses similar things she balances her loops on it. So she has to wear a face shield, loops, N95 and a surgical mask to do her pediatric dentistry. So those buttons have really helped to kind of alleviate that and make it a little easier. The other thing is I also have been a big advocate of choice. So face shields as an option and letting kids kind of transition throughout the day so that they can stay comfortable throughout the day. And sometimes building in redundancy. So wearing a face shield and then also wearing a mask, but allowing for some mask breaks. But that you don't lose all protection at any given time.
Have we seen
Can I
outbreaks?
ask you a question about this?
Oh,
Because my
yes.
read of the data has been that you need the mask and the face shield. Like the face shield's not an appropriate substitute for the
So
mask.
I think that the data on there is out. I would say the data is outstanding on just wearing a face shield and what the relative benefit of just a face shield versus a face shield and a mask are. And so, but there are two questions here. One is a face shield better than nothing? And so if for kids, if you're going to have them outside or if they're going to have to eat at school, is that an option? And the question is also who the person is. So clearly, a lot of the transmission has been adults and teenagers. And so for really little kids, for a 3-year-old, is it better to have them in a face shield or is it better to have them in nothing at all or something that they can't keep on their face? And I think that's an area where data is still outstanding, but I would come down on the side of a face shield is better than nothing.
I agree with that.
Sarah,
So my read of the data, for what it's worth, and Weston, I wish we could talk about this for an hour. So my interpretation of the data is that the mask matters more than the face shield. And again, we've been writing on this at Dear Pandemic, and I just want to show this disagreement that we scholars are continually learning. And Weston made a great point.
So you don't know either.
That the data are emerging, right?
Yeah. So here's my question.
Kara,
can
I address this from a slightly different perspective about the daycare?
Yes,
kind of a little bit separate from the mask wearing. I think one of the big misconceptions that we have as a society right now is that children are major epidemiologic drivers of COVID. You know, we've seen studies come out that indicate children have high copies of the PCR RNA in their nasopharynx pharyngeal cavities. We've seen some prevalence studies that show that kids, can get disease, but none of these indicate that kids are more infectious. And I think, in fact, if we look at data from US daycares that have been open for essential workers since the pandemic has started, if we take a look at worldwide data related to schools, for example, it becomes really clear that we haven't seen major outbreaks that have been attributed to children in school or specifically children in daycare. So
you just answered the question I was going to pose.
Yeah. So my take on this is, yes, children can contract disease and to some extent they can spread it, but they are not the epidemiologic drivers of COVID in any community. The adults are. So to have our children making huge sacrifices like not going to daycare, not getting that social interaction, not going to schools, while adults are out living their best lives in casinos and bars, which are open right now, to me, that's absolute insanity. So I think, I was just going to say, additionally, I think the younger kids it really is quite clear from the epidemiologic data that they are really not major transmitters of disease. So I would feel quite safe if I had children in a daycare environment, that if there were mitigation strategies in place, I would feel very, very safe sending my children.
So here's the question, and I think that this is actually something that came in from several audience members. Who are these people who is still getting COVID? Why is it still, we're hearing, 300 new cases yesterday. And so people want to know, who are these people? And I
want to hear from Lakshman on this, because it has a real equity lens.
Who is at risk? Who is at risk?
Lakshman, I want to hear you.
So I think this is the thing, is that it all, with COVID, you cannot go for more than a minute speaking about COVID before you come back to equity. So who are the people getting sick?
Exactly.
We know over and over again that it's Black and brown communities in inner city Boston. These are in other parts of the city. So that's who we're seeing get sick. And not only are they getting sick, that's who we're seeing die, right? And so it is serious, right? Low prevalence is privilege, right? It's not true everywhere. And the answers that we apply in one place don't apply somewhere else. I think also, I always, I'm looking at also how many people are dying, and I think people are worried about that a lot. Let's remember that as an ICU doctor, that's something that often happens like way later. So that's a lagging indicator, right? You see that, and that's something that's reflecting like the past in a way. But coming back to the equity point, I think this touches on everything we've been talking about, because a lot of the people who are getting sick and who are in these higher risk situations, who are parents in higher risk situations, they're not making choices. They don't have the privilege to make choices.
Right.
Their kids have to do something, right? They have to work. They have to be in congested indoor environments.
Right.
So
and I think that it's so important to say that, right? You know, even though prevalence is low, it's not non-existent, and there are actual real people who are still suffering, who are parents, who are children. And so how could we do our best then to protect them?
And so this is what I think we mean when we say, we're all in this together. That's not just kind of like a cute phrase. We are literally all in this together. If a prison gets an outbreak of COVID, it affects Newton, right? If it affects everyone. The prevalence affects everyone, although there's hot spots, there's like COVID traps and, in like these indoor congested areas. Yes, it's worse there, but it affects everyone. And the only way we really control that is by controlling it from the lens of the entire community. So that's why I think it seems like maybe I can just go out to and sit indoors at the bar down the street and hang out with a bunch of people. And you know what? The risk is lower to me, but that doesn't mean that it's okay for the community. It's going to have an impact.
And it's not
about another
bar worker or the restaurant worker. It's the essential workers. And then they go home to crowded indoor spaces with multi-generational households where they can seed an outbreak among a very vulnerable family member.
Right.
So
let's talk about another high-risk group, because I want to give the audience time to weigh in as well, and it's getting to be 11:15. But I don't want to neglect another high-risk group, which are grandparents. And people are wondering about this. This is another big question. So let's use my situation as an example. So I have a family member who's high risk who cares for my 3-year-old. And a big reason why I chose not to send my 3-year-old to nursery school is because he was going to have interaction with my high risk parent. Okay. So what is the right, or how would you advise a parent? I hate to say right, but how would you advise a parent in a similar situation? Under what circumstances is it safe to see elderly or at-risk family members? How can we do that safely? And if you do want to do that safely, should you not send your child to school? What's the right answer there?
So I think
or the best
the first
answer
thing is that everybody has a different risk tolerance, and everybody has different values. So I'll tell you, my grandmother is almost 94 years old. And so I put her in lockdown back in February. She was planning on going to New York City, and I said, absolutely not.
You said no?
Staying in the house. And so then the months passed by, and it got to be June, and she finally called me up and she said, this is intolerable. Like, I haven't had anybody in my house. I probably, I don't know if I have more than 6 good months left. Like, I need to see people. He was like, I'm going to die if I do not see people. And there have been, I personally know some people who passed away really due to death and despair. And so it's important to hear from your family members what their value preferences are. And my grandmother made it very, very clear to me that she was done never seeing anyone at all. So we talked about it for a long time, and we have seen her outside. I always maintain greater than 6 feet of distance with her. We avoid meals, and she wears a mask and a face shield at all times. I do both. So getting back to Lindsay's point, when I say eye protection, the eye protection is in addition to mouth protection. So she wears both of them at all times, and we maintain even additional layers of protection than what I require when my kids, if they were going to play with their friends outside. And so, but that was her preference, right? She called me up and said that I have 6 months left and I'm going to die at home alone. So
I also think the calculus for grandchildren interacting with grandparents is different when you're looking at ongoing interaction, for example, in a multi-generational household or where the grandparent is serving as the caregiver versus a more episodic situation.
Can you say more about that? Yeah.
So like in my family, my parents don't live that close to me, so they don't serve as, childcare providers for me. So we have seen them, and when we see them outside. We actually have slept in tents when they came to visit so that they could sleep inside the house, but that's a very different situation. And so in that context, we're able to do these kind of briefer visits outdoors, distanced fairly
Yeah.
safely. If somebody has a different situation in which they have, you know, an elderly grandparent living in their house or providing ongoing childcare, I think the risks that those children are able to take as far as interaction, or that anybody in that family is able to take as far as interacting with their peers, it's a very different calculation in that situation. So I think that those answers really have to be tailored both to everybody's risk tolerance, but also everybody's individual situation. I think, unfortunately, there's no right answer that's going to work for every family, but those are some of the things that need to weigh into that discussion and that calculus. I also think, sorry, the one other point, as Weston alluded to, is that being really open and frank with your family members about what your risk tolerance is, what other activities you are engaging in, is really important to allowing them to make an informed decision about what kind of interaction they're willing to have with you and your family.
I want to ask you about that. So that's a great point. And I think that something that COVID has brought to the fore is, and I think parenthood has always invited judgment, right? In some ways, right? Regardless of what the topic might be. How do we broach those topics of risk tolerance, right? So how do you say to a child, you know, to a neighbor, I'm sorry, my child, you know, you guys don't wear masks. I'm nervous about my child interacting with you, or a family member who you'd like to get tested before they come visit. I mean, is anything off limits, or is this disease just so damn scary that people should just feel free to lay out their boundaries however they like? What do you do?
I think we have to get a little bit comfortable with that discomfort, right? Like before my children have play dates at other people's house, pre-COVID, I always asked if there were firearms in the house. And the first few times that I did it, it felt awkward. And, you know, sometimes I will preface it by saying this is a little bit awkward, but for my own comfort, I feel like I need to bring this up to you, and I need to have what may be a challenging discussion. But I do think that we need to get comfortable having these hard conversations so that we don't face regret after.
Yeah.
A lot of having to do with thinking about grandparents, a lot of it is about doing something where you're also going to feel comfortable and not going to have a lot of, like, you know, to think about the whole picture. There's people in my family, I mean, my kids have seen their grandparents a number of times. They live in Ohio. There's been a lot of driving, a lot of not stopping at rest areas. It was like really intense for a while. And I think that's one way of approaching it. But there's people in my extended family who think the way we behave is outrageously risky. There's people in my extended family who I think they're too risky. And so these are, like, you know, like we're saying, you just have to have these open conversations. You have to realize there is no zero risk situation, period. And there's important ways to consider what is the real risk. And that's a hard thing to do, but it's worth doing. You cannot be binary about risk. Similarly, I mean, I think you want to curb things, but for example, you have to be practical. Not everyone has the privilege of not seeing grandparents. It's a privilege that we can not see them, that they are not like multi-generational home, living in the house and all these things. So again, like I hate to keep going back to that idea of privilege, but if you're with your grandparents a lot, that's going to change. If you're with elderly people or people with other health problems a lot, then that's going to change what your kids can and can't do, right? Normally, I mean, my kids aren't wearing eye protection when they're going outside. They can maintain distancing and all of that. But I'll tell you, if the kids were living with elderly people and like there's a high risk there, if all these things come together, then suddenly I'd be thinking, oh, maybe I do like need to elevate that little bit more protection, right? It's not always necessary. And that's what's hard, is that there's no black and white rules. There's no clear answers. It's all about like, well, do I need to do a little bit more? Do I need to pull back a little bit?
Let's pull back on that a little bit though, because I just want to, I think that we're dancing around this a little bit, and maybe there's no other way to address it. What are some uniformly bad ideas? What should people absolutely not be doing across the board?
If something is totally an elective thing, right? If something's totally elective and it's indoors and congested, then you should not be doing it.
And that's over parties with your 8 best friends. Pretty much no way to do that safely. Like those are the circumstances where you have a confluence of things, right? You've got multiple different people that are likely in different family groups, different pods. They each have their own level of risky behavior. Then they're coming together in a small enclosed environment for a prolonged period of time without masks. I'm going to go with sleepover parties. You know, on the flip side, if you have 2 or 3 kids together in a tent outside having a sleepover party, and they're in individual, tents for the night, like they can still have a lot of fun. They can still roast marshmallows, there's ways to do things that are fun, but I would say indoor sleepover parties is my absolute no-go.
That's a no-go. What are your no-goes, Lindsay and Weston?
So I will tell you, I'm fortunate my kids don't actually do team sports. So I would have a lot of hesitation about some of the indoor team sports that may be occurring where there are a lot of interactions in small spaces.
Yeah.
Also, I think things like singing and instruments. So my son plays the clarinet, and we did make the decision that his clarinet lessons are going to be entirely remote. We aren't going to do that in person because things that cause people to expel a lot of droplets, there's a difference between, it's complicated because it's a complex interaction of community prevalence and what you're doing and where you are, but different activities induce different risk. And so specific high-risk activities like athletics and certain athletics indoors and singing activities, particularly those that are in indoor and poorly ventilated areas, are no-goes for us. And so it's unfortunate because we're a big believer in music education, but that's all going to be remote this year, and I just don't see a way to make it safe other than to do it remotely.
Lindsay?
So I'll tell you a story from my work life instead of my home life on this one. We are in an unfortunate situation right now here at Tuck where we have 26 students in quarantine for having had a big dorm party.
Sounds like around here. We are seeing that too.
That's a no-go.
Yeah. Yeah. Let's try to forecast a little bit. So we have 4 minutes left, and I'm curious to know, and I think that it's on everyone's mind. And
really quickly.
Oh, go ahead.
Sorry, really quickly. I think, that doesn't mean all indoor things are necessarily off. I think it's possible.
Yeah.
There's some things you could do. Like, for example, if you don't have that many people and you have the luxury of a bigger space and everyone's masked, could you dance indoors? Probably. I think it's like you're gonna accrue a little bit of risk doing it. How long is the session and all that? I'd rather do it outdoors, but this is where like there's gray area about a lot of this.
So I totally agree. It's kind of the things where you're panting a lot and expelling a lot of, you're running around a lot, so you tend to be making more droplets and potentially more virus can accumulate in the air. It's things like that. I don't mean to imply you can't ever do anything inside. It's really, but you do need to think about the specific activity and whether or not that activity is going to increase droplet transmission and droplets building up in the air so that you can induce transmission that way. Also, time is a big part of it. So you can do a low risk activity for a long time and get a transmission, or you can do a high risk activity for a short time and get a transmission. So you also don't want to be standing, even in a low risk setting, you don't want to be doing it for hours and hours on end.
Right. Leaving off, signing off, I want to get your thoughts about a year from now. Let's just forecast a little bit. Put yourself in, September 2021, where are we? Are we right back here having the same conversation? What's changed? What's better? Is there any cause for optimism or not?
For me, I think a really viable way out of this pandemic, even without a vaccine, is increase access to testing so that people can do testing and understand what their infectious periods are and be able to make decisions based on that. So I'm really optimistic that over the next year, if we have improved technology, improved distribution, we can end up in a situation where, in addition to just difficult to obtain diagnostic testing, we have easily accessible, easily low cost tests where people can test themselves with some recurring frequency. We can make a lot of strides towards moving life back to normal.
Okay.
And to expand on that, and in the interest of full disclosure, I do work on COVID treatment trials, and I am—
Tell us everything.
That is the space that I work in. My hope would be a combination of a testing strategy with an effective post-exposure prophylaxis agent. So we've spoken a lot, for whatever reason, the concept of a vaccine dominates the news. But for example, with flu, one of our major mitigation strategies is that we can give Tamiflu so that if somebody is exposed, we can reduce their risk of getting the disease in that setting. Right. And I think that there is some reason to be optimistic about potential for post-exposure prophylaxis for COVID, so that it becomes less of a kind of dire situation if somebody is exposed. And so that's my hope, is that we have a post-exposure prophylaxis strategy.
Okay. Lindsay?
I think
Or
for me, oh,
Lakshman?
sorry, go ahead, Lindsay.
Either or.
I think for me,
Lakshman, go ahead.
it's individual decisions are only a part of it. I think we can only overcome this and change the way that we have to live as a community. I think that comes through all levels of leadership. So I'm optimistic that we can really kind of come together and see the big picture and change the way that we operate as a society to care more for one another. I'm optimistic
Lindsay.
about that.
I'm hopeful, but
excellent
I'm the resident optimist among the nerdy girls. I look at all the grassroots innovation going on at the bench, at the bedside, and in broader society, and I think we're going to be in a better place. But I don't have a crystal ball. But I am hopeful.
On that note, I would like to reintroduce Roddy from Children's Hospital, and I want to thank all 4 of our excellent panelists for sharing a little bit of knowledge today. It was so helpful and great to talk to you all. And signing off with Children's Hospital now.
Thank you all. As a father of a 14-year-old and 2 11-year-olds, this has been incredibly informative. Thank you all for joining us. As I said at the top, there's parenting resources at bostonchildrens.org/COVID-19. I hope you found this as useful as I did. And thank you all the panelists. This is great information as we go into the fall. And Lakshmi, your point about diverse communities is well heeded. The comments in the section, there's been many. Merits additional discussion.
Thank you so much, everybody. And I just want to put in a plug for our parenting newsletter that drops this Thursday at 4 p.m. Every week on Thursday. And we'll be discussing a range of COVID topics, from health to education to socialization, that affect a diverse and broad array of the region's families. So thank you all so much for coming.